Good morning, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, followed by Dr. Vera Etches, Chief Medical Officer of Health, médecin chef en santé publique, and Akash Hoffer, CEO of the Pearly and Rideau Veterans Health Center, président directeur général du Centre de santé Pearly et Rideau pour les anciens combattants. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, gestionnaire d'immunisation Santé publique Ottawa. After hearing from the panelists, we will take questions from the media. We will now begin with remarks by Anthony DiMonte.
Thank you, Kina. Good morning, everyone. Bonjour tout le monde. I'm happy to be here today to provide you with an update on behalf of the City of Ottawa's Emergency Operations Center Command Team. This team includes those working under the mandate of the Vaccine Distribution Task Force, but also leverages additional expertise from across the city to ensure enhanced coordination in 2021. In our joint memo to Council yesterday, Dr. Etches and I outlined the various tactics that will be used to distribute and administer COVID-19 vaccines across our city throughout the year. These tactics include hospital clinics, such as the one currently in operation at the Ottawa Hospital, mobile vaccination teams, community clinics, pharmacies, primary care health providers like family doctors, and other healthcare professionals such as nurses working in congregate living settings, including long-term care homes and shelters. And today we are beginning to roll out the vaccine with a mobile vaccination team to one of those congregate care homes. It is the first time in Ottawa where the Pfizer vaccine has been transported and administered outside the hospital clinic. This announcement means that we are now able to start vaccinating our most vulnerable population, residents in our long-term care and retirement homes, and a target that Dr. Etches has been talking to us about quite a bit, and we want to ensure that these patients receive this vaccine as quickly as possible. The Pearly and Rideau Veterans Health Center is the first location for the vaccination, and you will hear more about this from Dr. Etches and Akash Hoffer, CEO of the Pearly Rideau's Veterans Healthcare Center. As we proceed to other long-term care and retirement residences, the city's command team has established a model for mobile vaccination teams for on-site distribution. These teams consist of Ottawa Public Health staff, Ottawa paramedics, and pharmacists from the hospitals to help oversee the vaccinations. While today is an important step in our community rollout, I want to remind everyone that this rollout will be gradual and a steady process as we continue to move forward. Further expansion of the rollout depends on the amount of vaccine we receive from the province and any additional direction we receive from the provincial task force. As we continue to vaccinate our priority groups this winter and early spring, we are also continuing to prepare for community-wide vaccinations. We want to have our posture forward and ready to go. We intend to move as quickly as possible, subject to the vaccine availability. This is evidenced by our announcement yesterday that 4 clinic sites are ready and located at the Horticultural Building, the Eva James Memorial Center, the Orleans Client Service Center, and the Nepean Sportsplex. They're ready to open as soon as there would be enough vaccines available to administer in those settings. If the vaccine quantities are available, we are ready to immunize up to 680,000 residents by Canada Day. I know everyone is anxious to turn the page on 2020 and to return to some type of normalcy in 2021, but this fight against COVID-19 is still far from over. That's why it is so important for us to keep our guard up and to protect ourselves and our loved ones and our community. That means continuing to wear a mask, maintaining physical distancing, and having no indoor gatherings with people outside of your household. Until the vaccination efforts reach herd immunity level, our defensive measures remain our best offense. Right now, we're seeing higher numbers from those recorded before Christmas, but we can get those numbers down. You did it in summer, you did it in October, and we can do it again. I thank you for your continued patience and for your efforts to protect yourself, your loved ones during this pandemic. And I want to reassure everyone, the city, Ottawa Public Health, the Ottawa hospitals are all in your corner all the way. We will continue to communicate with vaccine updates, answer your questions, and encourage everyone to join us to roll up our sleeves when we have enough vaccine and defeat this virus. Nous continuons à communiquer avec les mises à jour de vaccination, à répondre à vos questions et à encourager tout le monde à se joindre à nous pour retrousser nos manches et vaincre ce virus. Thank you very much. Merci beaucoup.
Merci beaucoup, Monsieur Dimonte. We will now hear from Dr. Vera Etches.
Hello, Quay. Bonjour. I would like to wish everyone a happy and a healthy new year. And first, I want to focus on this main subject for today that others are speaking to, that we're rounding another corner with being able to distribute the Pfizer-BioNTech COVID-19 vaccine in long-term care homes. Aujourd'hui, nous franchissons une autre étape avec la distribution du vaccin Pfizer-BioNTech contre la COVID-19 dans les foyers de soins de longue durée. So as an initial rollout in Ottawa, the provincial government has lifted restrictions to allow the Pfizer COVID-19 vaccines to be administered in locations outside the Ottawa hospital. And the COVID-19 vaccine rollout will continue today, starting with the residents of the Pearly and Rideau Veterans Health Centre. This is the first opportunity to bring the Pfizer vaccine to residents, where previously people could only be administered this vaccine at the Ottawa Hospital. And we are very excited about this. It's an encouraging milestone in our response. We have seen the disproportionate impact that COVID-19's had on people living and working in long-term care and retirement homes. So we're one step closer now to helping protect those in the community who need it most. And we're working with these long-term care home partners, every day, the Ottawa Hospital constantly, and the city, again, very integrated efforts to make sure that all the eligible residents of Ottawa's 28 long-term care homes are vaccinated against COVID-19 as soon as possible. And it is dependent on the vaccine supply. Nous prenons un autre pas vers la protection des personnes les plus vulnérables dans notre communauté. Santé publique Ottawa travaille en étroite collaboration avec nos partenaires de soins de longue durée, l'hôpital d'Ottawa et la ville, pour que tous les résidents admissibles des 28 foyers d'Ottawa soient vaccinés contre la COVID-19 dès que possible, selon la disponibilité des vaccins. Et il y a l'espoir. De l'espoir pour notre personnel de soins de longue durée et nos résidents, et de l'espoir pour la ville d'Ottawa. There is cause for hope, and hope for our long-term care staff and residents, and hope for all of Ottawa. So while it's important to remain hopeful, to see this is coming, we also have to remain cautious, and we have to return to the practices that kept transmission low before the December holidays. I want to thank everyone who's been doing their best to stay home. Unfortunately, we are now securely in the red category of the province's framework according to our numbers, and the provincial shutdown restrictions remain in effect for Ottawa. Until there are vaccines widely available, it remains important to protect ourselves, our loved ones, and our community against COVID transmission. It means staying home, right? You've heard this, limiting your close contacts. I just need to make it a bit more clear that I am very concerned about the current situation. We have a few myths out there that maybe this transmission is coming from people who didn't obey the rules and have done things like travel. Actually, most of this transmission is still coming from the gatherings we have with friends, family, neighbors, indoors, without the distance and without the masking. And it's happening in workplaces. You see the number of workplace outbreaks that we have on our website have gone up. And it's unfortunate, for essential workers who need to be out working, that there's still risk when they're within 2 meters of others in the workplace, especially during lunch when the mask comes off. And so again, maintaining those distances is important. Another myth I want to bust is that the hospitalizations are not just people in long-term care and retirement homes or somebody else. Actually, at this moment, all of the hospitalizations are people who are coming from the community. None of the hospitalizations right now are people in long-term care or retirement homes. And the hospitalizations include people in their 20s, in their 40s, 50s, 60s. So it's just important to realize this is a problem right now. The level of transmission of COVID-19 in our community is starting to cause hospitalizations to go up. They were at 10. Was good. That was very manageable. They've gone up to 18. You know, within a week, going from 10 to 20, the hospitals can manage that. But that rate of increase means then the next week, 20 becomes 40. And then 40 becomes 80. And that's only in a matter of a couple of weeks. And that is not manageable for the hospitals. And that leads to the cancellation of surgeries and the challenge with getting emergency care. So I guess I'm going to go back to my statement, which is to say, yes, it does work. We can change this if we do the distancing from others, wearing our masks, washing our hands, and avoiding crowded places. So, selon nos indicateurs locaux, Ottawa est fermement dans le niveau rouge du cadre provincial et les restrictions de fermeture sont toujours en place. Il faut rester à la maison autant que possible, limiter vos contacts étroits avec les membres de votre ménage. Vous tenir à 2 mètres des autres, portez votre masque et vous lavez les mains souvent. Évitez les endroits occupés. So again, I'd like to take a moment to discuss how we have to remain COVID-wise at all times, even outdoors, right? So last week, the city announced a temporary mask bylaw for all the outdoor refrigerated and community skating rinks to try to keep each other safer, reduce the transmission of COVID-19 from crowding outdoors. And again, skaters, you know, from not the same household need to keep that distance on and off the ice. Masks aren't mandatory while skating, but they're highly recommended. And the large crowds that have been observed at outdoor skating rinks, tobogganing hills, skiing trailheads, they are raising concern for me that we need to decrease that crowding. And so I will be issuing a class order under the Health Protection and Promotion Act to all residents in Ottawa and all people responsible for the ownership and operation of outdoor recreational spaces that will indicate the additional requirements like signage, maintaining physical distance of 2 meters, and a maximum capacity of 25 people on the ice surface at any time. For tobogganing hills, ski trails, again, a maximum capacity of 25 people in the common gathering areas, like where there could be crowding in parking lots or trailheads at the top or bottom of hills. Compte tenu de foules observées récemment aux patinoires, aux pistes de glissade et aux sentiers de ski, je délivrerai demain une lettre détaillant l'ordre en vertu du paragraphe 22 de la loi sur la protection et la promotion de la santé à tous les résidents d'Ottawa et à toute personne responsable d'espaces de loisirs extérieurs indiquant des exigences supplémentaires, y compris des panneaux d'information pour maintenir une distance physique de 2 mètres. Il y aura une capacité maximale de 25 personnes sur les patinoires à tout moment. Et pour les pistes de glissage et les sentiers de ski, il y aura également une capacité maximale de 25 personnes dans les aires de rassemblement communes, par exemple les stationnements, les départs de sentiers et en haut et en bas des collines. So, as we know, physical activity and spending time outdoors is so important for our well-being and mental health. And I do encourage people to get outside and enjoy the beautiful winter amenities in Ottawa safely. We just need to remember that even outdoors, physical distance is important, and let's avoid the places that are too crowded. The rate of increase of COVID-19 in the community is too fast, as I mentioned, for hospitals to be able to avoid canceling surgeries again if this continues. And yet we know we still will have probably worse numbers in the days ahead of us. The outbreaks we're seeing are still related to the gatherings that happen right around the holidays. We're going to then follow up and find the people who were contacts who have tested positive. So maintaining the behaviors that stop COVID-19 transmission will also address another risk we see, which is the importation of the UK variant. right? It's more transmissible. It would make bringing the virus levels down in our community even more difficult. So Ottawa Public Health is asking anyone who traveled from or through the UK or South Africa in December and their close contacts to present for COVID-19 testing at an assessment center, even if asymptomatic, to get a better sense and assess the risk of importation of the UK variant. You know, it's been a lot of concern, but I do want to go back to today being a good day. We're vaccinating directly in long-term care homes, and this will help save the lives of those who are most at risk. And one day soon, the vaccine will be available to anyone in Ottawa who wishes to receive it. Aujourd'hui est une bonne journée pour nous à Ottawa. Ces vaccins aideront à sauver la vie des personnes les plus à risque. Et bientôt, le vaccin sera disponible pour tous ceux qui souhaitent le recevoir. So until then, please stay safe. I know we can do this. Be well. Look out for one another. Thank you. Merci, miigwech.
Thank you very much, Dr. Etches. We will now go to remarks from Mr. Akash Hofer.
Thank you. And I'd like to begin by saying Happy New Year and by thanking Tony DeMonte and Dr. Etches for their leadership and support for today's announcement. Together, we're protecting the most frail and vulnerable members of our society, namely our veterans and our seniors. I'd also like to thank the staff at the Ottawa Hospital for the central role that they've played in administering the vaccine to date. At Pearly Rideau, our mantra throughout the pandemic has been, by standing strong and lifting each other up, we will get through this. And while I would like to amplify Dr. Etches's comments by acknowledging that we're nowhere near out of the woods yet, I can think of no better way to lift up our community than with the arrival of the vaccine. So clearly it's very, very good news. It's being received extremely positively here at Pearly Rideau. With the start of the vaccination campaign for our residents, we are going to build on the momentum that has seen more than 800 of our staff and caregivers already roll up their sleeves to protect our community. And one of the ways we did that is by going to great lengths to reassure our staff and caregivers that the vaccine is actually safe. And speaking from personal experience, after having received both doses of the vaccine, for me, the most noticeable side effects have been increased hope, gratitude, and confidence. And that is a message that I think is getting across here at Pearly Rideau. Our team of nurses and physicians are very grateful today because they've been asked to administer the vaccine to our residents. And that's really important, especially for residents who are dealing with dementia. Having a friendly face administer the vaccine will make the process so much smoother and will help us vaccinate the maximum number of eligible residents as soon as possible. I'd also like to say a special thank you to the many family members who have persevered with us throughout the pandemic. They've been extremely supportive. They've contributed a lot to our response and helped to keep us on track throughout the pandemic. And in closing, I'd also like to directly thank all the staff and residents for their patience and support. To date, you have undergone more than 13,000 COVID-19 swab tests over the last 9 months. And there were countless changes to routines and the implementation of safety protocols. Yet our staff were single-minded in their actions to keep our residents safe and adapted with grace and respect. Thank you again.
Thank you very much, Mr. Hofer. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. Nous allons commencer par Caroline Bertrand à FM 104.7 Outaouais.
Oui, bonjour. Ma question va être en français pour Dr. Vera Etches. En fait, ce serait surtout pour revenir en français justement sur la situation des hospitalisations. Vous avez parlé que ce sont principalement, en fait, que ce sont des gens de la communauté qui sont hospitalisés présentement, pas nécessairement des personnes des centres de soins de longue durée. Donc, juste si vous pouvez revenir en français sur cette partie-là. Et en fait, est-ce que vous associez donc la recrudescence des cas aux rassemblements qui ont lieu dans le temps des fêtes, ce qu'on vit présentement à Ottawa?
Oui, je pense que votre question, c'est concernant le cause de l'augmentation de la COVID-19 dans notre communauté.
Oui, bien, c'est surtout revenir en français sur la partie des hospitalisations où vous expliquez que c'est des gens de la
OK,
communauté, en fait.
OK, OK. Je vais faire mon meilleur. Oui, je voudrais expliquer que maintenant, la quantité d'hospitalisation était double pendant la semaine passée. Alors, 10 devenu 20. Et si le taux continue comme ça, l'augmentation la prochaine semaine, ça va être 40. Et après ça, 80. Et c'est trop pour la continuation de service dans notre hôpital. Et aussi, un point peut-être intéressant pour la population, c'est que le nombre de personnes dans les hôpitaux qui habitent dans les foyers de soins de longue durée ou les maisons de retraite, c'est 0. Habituellement, c'est la population la plus vulnérable. Avec les éclosions, oui, on voit les hospitalisations, mais maintenant, c'est les gens qui habitent dans la communauté qui est dans cette chiffre dans les hôpitaux. Et c'est aussi les gens plus jeunes, les gens dans leur vingtaine, leur quarantaine. C'est pas juste une idée que c'est quelqu'un d'autre. Le COVID-19, le niveau dans notre communauté maintenant, ça touche partout la ville, tous les âges, c'est trop haut. Et on a besoin de réduire les contacts entre eux, de changer cette situation.
Merci beaucoup pour ma question. Ma deuxième question, je veux parler en fait de la situation du confinement. Je sais que ça a fait réagir lorsque le gouvernement de l'Ontario a annoncé un confinement de 4 semaines à Ottawa. Avec l'évolution de la situation, est-ce que vous pensez que finalement c'était la bonne décision que ce soit 4 semaines et non 2 semaines? Est-ce que vous pensez même que si la situation empire, le confinement pourrait devenir plus sévère, comme on risque de vivre ici au Québec là, à partir des prochains jours?
Oui, c'est clair que nous avons besoin de continuer avec la protection d'un confinement pour le 28 jours, journée. Et j'observe dans différents domaines, différentes géographies, qu'il y a une augmentation dans les cas encore avec ces mesures de confinement. Alors oui, je peux voir que dans quelques régions, on utilise les méthodes plus strictes. Et si on continue avec une grande augmentation dans les cas, on a besoin de discuter les différentes options. Vraiment, c'est clair. Ça prend temps de changer la courbe encore, mais c'est possible. Et le plus vite, ça c'est important, le plus vite, nos actions aujourd'hui peuvent aider d'avoir un confinement plus court.
Merci beaucoup.
Merci beaucoup. We will now go to Joanne Chianello at CBC Ottawa.
Hello, bonne année. I wanted to get a little bit more clarification on the vaccination program. Mr. DeMonte, I know you say, of course, everyone is very interested and patient to get it. And I'm not sure who wants to answer this, perhaps a number of you. And that is, how is it being rolled out right now and over the next few weeks? For example, we're hearing that some frontline workers are not getting it, but relatives who are caregivers to someone in a long-term care home may be getting it. So can you explain the prioritization, who's getting it, and what we can see over at least the next few weeks, because I know that it's going to change as we go on. And I would also ask that we get the answers in English and French. Thanks so much.
Sure, Joanna, I can start, and certainly Dr. Etches may want to add a bit of her expert opinion as well, too. So the the order in which vaccination is being done is dictated by the province through work that an expert panel has looked at, ethicists and physicians and public health experts. So in very simple terms, with a limited amount of vaccine, because that's our challenge, that's the other issue in the community. There seems to be this thought that, you know, a whole bunch of people want to help us vaccinate, etc. We don't have a challenge right now with clinicians to vaccinate. We don't just have enough vaccines. So we are following that priority list. The priority list is clear. We had, as you know, there's two tools right now. There's Moderna, which is a little easier to move around, but that isn't in our jurisdiction. That's the limited amount is in the GTA in 4 regions, and it'll be used up north as well too for those communities. So we had Pfizer, and up until today, as a matter of fact, even Dr. Etches and I, when we had provided our memo and update, we weren't able to do that. And today's good news, we're able to do that. We can now move Pfizer outside of the institutional clinical setting and start doing the most vulnerable of our population. So directly your question, we are now going to the long-term care homes. That is our first priority. The staff, and most importantly now, because we can get there, the residents of the long-term care home, because we were doing initially the staff at the Ottawa Hospital Clinic because they could go there, but the residents. So that's our target. In the next few weeks, we're targeting them. We want to get them all completed. And then we're going to go look at the residents as well too in the in other residents where there's elderly patients in congregate settings as well too. So those are our two priorities. That's what you'll see us focusing on over the next few weeks. Your other part of your question is there are criterion for healthcare workers that have been established too. So while we were able to do some healthcare workers, they've been specified. So those working in long-term care centers, those working in hospital institutions in specific areas, emergency rooms, intensive care rooms, or COVID wards, for example, are individuals that are part of that first group. But again, I hesitate to say that we could open it up because it's all dependent on the capacity and the volume of vaccine that we have. So that's why we're in essence triaging and focusing on what Dr. Etches and the provincial group is telling us. These are the priority groups. So definitely long-term care and the residents there are our first priority. So that's what you'll see, Joanne, over the next couple of weeks. I'll let Dr. Etches add anything she wants to, and then I can give you a bit of that in French as well too.
Yes, so I agree with what Tony said, of course, and just to be specific about the long-term care home and retirement home population as the top priority to protect, it does mean everyone who works in those settings, whether they come in and out, they might be someone who comes twice a week to work, that is still somebody who needs to be protected to protect that population, the people who live there for sure, and the essential caregivers. So the long-term care homes have a list of who the essential caregivers are for each resident. It can be up to 2 essential caregivers per resident, and that is the list of people that are being included in getting instructions about how to register and go to the Ottawa Hospital for immunization. The other thing you're going to continue to see over the next couple of weeks that Tony just didn't mention, is sort of maybe implicit, is that the Ottawa Hospital Clinic is now giving second doses. I guess that's another thing to celebrate today. They are starting to give the second dose to the first people who were vaccinated, the long-term care home workers, and so that will continue at the Ottawa Hospital. So we have these two tracks continuing at the Ottawa Hospital, and then as much as we can moving the vaccine out to the long-term care homes and retirement homes. Tony, vous pouvez expliquer plus en français peut-être?
Oui, Dr. Etches. Donc, essentiellement, dans les prochaines semaines, notre focus est vers les centres de soins de longue durée et les centres où on a des gens plus âgés, et les gens qui travaillent dans ces institutions-là. On est maintenant avantagé qu'on peut prendre le vaccin et le distribuer à l'extérieur du centre hospitalier civique. le vaccin Pfizer. Donc aujourd'hui, c'est la première journée qu'on fait cette démarche-là avec une institution. Et on est en train d'apprendre et s'ajuster en fonction de ça. Et dans les prochaines semaines, ça va être notre objectif parce que, comme le docteur Etches nous a indiqué, c'est la première priorité, c'est les gens les plus vulnérables qui ont le plus d'impact au niveau de leur santé et on veut les protéger le plus rapidement possible. C'est sûr qu'on aimerait donner le vaccin à tout le monde, mais on n'est pas dans cette situation-là. La disponibilité du vaccin est très limitée. Donc, on doit prioriser en fonction des priorités importants pour les plus vulnérables. Aussi, les gens qui travaillent dans ces institutions-là et les aidants également ont droit au vaccin. Il y a un processus clairement établi pour savoir c'est qui. Et par la suite aussi, les gens dans les services de santé, dans les établissements de santé, très déterminés, c'est-à-dire les gens qui travaillent dans les salles d'urgence, les soins intensifs et les unités de COVID aussi il est possible pour eux de recevoir le vaccin en nombre limité pour l'instant. Donc, pour les prochaines semaines, c'est un peu ça que vous allez voir. Le focus va être vers ces gens-là. Et je laisserai le Dr. Etches si elle veut rajouter des commentaires également.
C'est correct, merci.
Thank you very much, merci. For my follow-up, I wanted to just switch a little bit to the numbers, of course. Part of what we're seeing is some outbreaks in workplaces. You saw that Toronto Public Health is going to start naming the workplaces where there have been outbreaks or other community areas like restaurants, for example. Is the Ottawa Public Health looking at doing that? And maybe if you can comment on that practice generally. And again, if you have some comments in French, we'd also appreciate that. Thanks, Dr. Etches.
Okay, yes, so Ottawa Public Health has already, since December 30th, been posting more subcategories for workplace outbreaks on our website. So it's in our dashboard related to the outbreaks. So it's broken down by the type of workplace. The times when traditionally we would name a workplace are when we need to let people know that there is some risk and we don't have their contact information. And so that can happen, that has happened where we need to reach people. We can use the media and public notices to indicate a time and a place and a location where people need to know that they could have been exposed to COVID-19. Certainly saw what Toronto's planning to do. I think there are some questions about exactly how that will work, and we'll be looking at that.
And can you mention that in French? Thanks.
Oui, en français. Sur notre site web pour Santé publique Ottawa, on a une liste avec plus de détails maintenant concernant les éclosions dans les lieux de travail. Alors, ça, c'est là. Et on a aussi l'approche de partager le nom d'un lieu de travail quand il y a un risque pour le public et nous n'avons pas l'information pour contacter les gens à risque. Et on va examiner l'approche à Toronto. Il y a des questions et on verra si on peut changer notre approche, mais pour maintenant, on va partager le nom s'il y a une priorité d'informer les gens à risque.
Merci beaucoup.
Thank you.
We will now go to Alex Gouge at City News Ottawa.
Hello, my question is for Dr. Etches. I was just wondering if you could elaborate more on the workplace outbreaks and just what type of workplaces more generally are these coming from? Like specifically, like are these office settings or more like grocery stores, etc.?
Just turning off my phone. So what we're seeing is posted on our website, again, broken down in more detail. So it might not have had a chance to visit. It's just been up since December 30th. I think it shows you of the open outbreaks right now, a couple are due to construction sites. One is an office setting. We have one related to sports and recreation, 2 restaurants, 2 retail settings, another service setting for more like personal services. And so that's the type. You can see basically it's not limited to one type of sector. And what causes the transmission in the workplace is when there's close contact between people, when people are within 2 meters and they're not wearing masks. And so the biggest risk factor we see there is when people are sharing meals and breaks, smoke breaks, lunchtime, or a vehicle. If people are sharing a vehicle, these kinds of things are risks. And we have teams that are working with workplaces to help. Every workplace is meant to have a COVID plan to reduce transmission of COVID in their workplace. And Ottawa Public Health has a lot of resources. We're continuing that outreach where we see maybe there are some gaps. And these are all workplaces where we have had good cooperation with people. If there are gaps to be addressed, then we'll do that.
Thank you so much. And for my follow-up, for Anthony DeMonte, could you break down the logistics of the mobile vaccination units, please?
Yeah, so today's experiences was indicated. It's a team approach, and there's a lot of work that has to be done ahead, normally by public health with the institution that we're going to, consent forms, all that, and we have that all prepared. As was indicated too, some of these areas, these patients can be, have other issues, and so it's important that the staff there are fully integrated into the team. But in essence, the team consists of public health professionals, paramedics that will be helping vaccinate, and a command structure to support all that, as well as, because of the complexity of the vaccine, we bring a pharmacist. Initially, we're doing it with a pharmacist. You'll come to site to prepare the doses, etc., because there's a very not complex, but there's a very specific way of preparing the doses, because from their frozen state to be able to inoculate. So a pharmacist will be doing that. He'll be training the team. So we're marching this forward as we're learning from each of these institutions. And that's kind of, in essence, what you'll see. The objective as well is, as we've indicated, and as Dr. Etches has indicated, because these are our most vulnerable, if the more vaccines that we have available, we're able to ramp up and have more than one team. We can have multiple teams doing multiple facilities as we get more vaccines. So we're also preparing for that as well too. So in essence, that's what it is. It's a team that leaves in the morning, arrives at a predetermined institution that already knows. We've got all the paperwork prepared, and the team there at the institution and the staff there are aware of us arriving, and then the team arrives, and we want to go in, vaccinate every resident, and then perhaps every staff member and other people that have not had the opportunity yet to go to the Ottawa hospital, and basically check off the list that institution now is protected, and we move off. And then, as was indicated by Dr. Etches, we mustn't forget we've got to come back around for the second dose eventually too. So that's part of the planning process.
Thank you so much.
Akash, did you want to add anything about the logistics on the ground, or you're okay?
Well, I will just say that vaccinating residents is nothing new for a long-term care home. So every long-term care home out there would have a process in place for the regular flu vaccine that gets followed every year. In our case, we've done a lot of work around communicating and really engaging with staff to make sure they understand the benefits of a vaccine, and that if they're going to refuse it, for them to give us a reason why, so that we can help to address their concerns. So that's one of the reasons we have typically 90% flu vaccine uptake. So we're very happy with that. And I think our current experience lines up with that too. Thank you.
Thank you very much. We will now go to Ted Raymond at CTV Ottawa.
Hello, good morning, and Happy New Year to everyone. My first question is about this class order that Dr. Etches, you mentioned you are planning to issue. A little bit of a multi-part thing here, but I'm wondering if you can give us a little bit more information on when this is going out, how it will be enforced, if there's any fines related with it, and also, would this apply, this 25-person limit, to the Rideau Canal Skateway, if that's up and running?
Yes, well, the principle here is we want to avoid crowding, and even outdoors, because we see that people close together is a risk for COVID transmission, especially when the level's higher in our community like it is now. The order is being drafted today, and I believe it will either be posted today in effect tomorrow, or posted tomorrow in effect tomorrow. The enforcement is enabled right now under provincial legislation. It can be orders under the Health Protection Promotion Act can be upheld by bylaw officers, which is usually the first group that has been helping us with more of an educational approach, right? So we're not looking to be issuing tickets. We always start with our bylaw colleagues to make sure people understand. Because the rules change, we need to help people understand what is allowed and why, what the restrictions are for their health, for their protection and the protection of others. So I do believe that, in fact, Mr. DeMonte may want to speak to this, that will be following this path. And when it comes to the Rideau Canal, it's not your typical skating rink, so the 25 wouldn't make sense, but avoiding crowding would. And so, we always want to start with an educational approach and helping people understand and do the right thing, and that would include, we will be working with the NCC and helping with their signage and their instruction and what can they do to minimize crowds.
Yeah, the only thing I'd like to add, and Dr. Etches has mentioned, it is a different jurisdiction. It is the NCC. That said, throughout this pandemic, they've been tremendous partners and followed and tried to mimic and do what the city has done based on Dr. Etches' direction. So I'm sure they'll do the same thing. And yeah, as Dr. Etches indicated, I know the team is currently working with her team right now, our bylaw team, and I think we're looking at perhaps sometime tomorrow her order will come out. And so we've got to communicate that, get the signage up there, and our officers always use discretion. The objective here is to achieve our public health goals and protect our community. It's not about giving tickets, but if we have to, that is part of the enforcement tool that is available to us, and we proceed that way. But again, each officer has discretion to judge each situation and to achieve our public health goal is what we want to do.
Okay, thank you. For my second question, I guess I would just like to ask, because you say basically that you're ready to go. You're ready to get these vaccines out as soon as we get them. And given kind of, excuse me one second. Given some of the news about sort of the delays in getting doses out, vaccines kind of sitting around in freezers, how do you feel the vaccine rollout has been going in Ottawa? Are you pleased with how the province has been cooperating with you to get these doses to you, or do you think more needs to be done?
Well, I'll let Dr. S just talk too. I just from a logistics and from the responsibilities we have as a local community, I think it's important to reiterate to people, the federal government has a role to, procure vaccine, and Health Canada then authorizes them after their scientific analysis of each of the vaccines. And now we have 2 available in Canada. Then the provinces are the ones that distribute the vaccine that they receive. So there's a finite amount of vaccine, they receive it and they distribute it. So when it comes to that, working with the provincial task force and getting our quote unquote amount of vaccine for Ottawa, there has been no issue there. I think the issue is the amount of vaccine that we're receiving in Canada, and then ultimately through that chain locally to Ottawa, is far inferior to what we would like to have and to rapidly put in arms. But that's just the reality we have. And so with that limit, we are proceeding as we would based on science and evidence and the priority groups that we've just been talking about. And so, yeah, there's no challenge there. And I think I thank you for the question, because there's a lot of, it's like things are going too slow. It's like, we have physicians and other groups saying, we're ready to help, we're ready to help. That's not our challenge. Our challenge is I don't have enough product to put in people's arms. So I can tell you when we receive, there's a process with the Ottawa Hospital, with public health, and with the city teams and you saw all our tactics that we're ready to go. And we're even thinking further down the road. We have 4 of our 7 future sites for mass vaccinations ready to roll. So, it's just a question of getting product to be able to move it. So there hasn't been any issues in Ottawa. And as Dr. Esch just pointed out, that I forgot, we're already now in our second round of giving our second vaccinations to those who got the first ones of the priority group. So we're moving ahead without any issue. So it's not a logistical or a clinical challenge with regards to clinicians to be able to put needles in arms. We just don't have enough vaccine right now versus the demand that we would love to have.
And if I may add, I think that we are always wanting to be ready before the quantity of vaccine increases, so that as soon as we have it, we can use it. And so this does actually include, while we don't need extra immunizers at the moment, it does include reaching out to primary care now, because we know primary care is going to be an essential workforce, as they usually are, for immunizing the population. And so, Ottawa Public Health is welcoming those volunteers, and we have different methods we communicate with primary care in our community, and we fully expect that they will be immunizing with COVID vaccines as soon as the supply increases.
Thank you very much.
Thanks very much, Ted. We will now go to Craig Lord at Global News.
Thanks very much. I think this would be probably a question for Anthony DeMonte, but bringing the Pfizer-BioNTech vaccine to long-term care homes, I know there are very stringent preservation requirements, the cold temperature storage requirements. Are there any risks that you might see in doses spoiling or other logistical complications that could make this more challenging, and how are you addressing those challenges?
That's a good question, and thanks. No, actually, there aren't. We have a great group of professionals, physicians, and as I indicated, even for the beginning of this, we wanted to ensure that there isn't any challenge. We have pharmacists involved in the movement. So in simple terms, the preparation is done ahead of time with the long-term care facility that we're going to. The team leaves in the morning with frozen product that's taken out of the freezer by the pharmacist. It's transported to the locality, and then the pharmacist, under his or her professional process, then thaws it out and prepares it, and then that's turned over to the clinicians, whether it's the public health nurses, the paramedics, or as in this case this morning, the institutional staff that are there to be able to administer the doses. So there is no risk whatsoever there. On the contrary, we have clear processes in place, and this has been all mapped out by those professionals well ahead of time. And as Dr. Etches was saying, this is the kind of work we've been doing for some time and getting ready, because we were hoping this authorization of moving this product was gonna be done eventually. So no, I have no worries whatsoever with regards to that. And certainly, as we've been mentioning, there's so little vaccine. Every precious drop is we assure that we're going to be able to put that in arms, and there will be no spoilage.
Thanks very much. And for Dr. Etches, now that we have care workers getting their second doses and first doses going to some residents, when do you anticipate that the vaccine distribution will have a meaningful impact on Ottawa's COVID numbers, and how would you expect that to manifest in our weekly trends or those indicators that we're watching so closely?
Thank you. I don't think that the vaccination campaign will decrease the rate of COVID in our community for a while, like months actually. What I'm hoping it will do is decrease the hospitalizations and the deaths, because we've seen 80% plus of the people who have died in Ottawa have been residents of long-term care and retirement homes. And this is important. This is one of the top goals of our whole response is to decrease hospitalizations and deaths. And so I hope that we could see that in February, that the protection that's being provided now, it takes a bit of time after you get the vaccine, the first dose, to have a pretty good level of protection. After the second dose, again, high levels of protection. The workers are usually the people who are introducing COVID into the homes because they're members of our community, and the high levels of COVID in the community include touching our workers in long-term care homes. And so they'll be protected, and then they'll protect the residents. And this is what we're looking for. I guess the message to the rest of the population is clear then, right? That actually we still have a lot of work to do ourselves to bring those COVID levels down. We can't rely on the vaccine to do it. We have the tools though, we've done it before, the keeping distance, keeping to your household, stay home as much as possible. That actually hasn't maybe come through as strongly as it could. People did it in March, we've learned. We know people need physical activity. We know they need social connections if they're a single person. But it is a time right now to be as cautious as possible, do as much as we can, use this lockdown period to drive the numbers back down as low as possible, as quickly as possible. Otherwise, the measures will have to get stronger, right? If it's not turning the curve, because that growth in the curve is unsustainable.
Thank you very much.
Thank you. Nous allons passer maintenant à Julien Paquette à le droit.
Bonjour, je ne sais pas si c'est une question qui s'adresse plus à M. Dimonte ou à Dr. Etches, mais ça a été dit assez clairement aujourd'hui que la priorité, c'est la vaccination des personnes âgées les plus vulnérables et des travailleurs qui les entourent. Mais dans votre note d'hier, vous disiez être prêt à ouvrir 4 cliniques communautaires dès la mi-janvier. Ma question, en fait, c'est de façon réaliste, à quel moment est-ce qu'on s'attend à être en mesure d'ouvrir ces cliniques-là et commencer la vaccination de la population en général?
Merci. Et comme on indiquait, la Ville se prépare. On veut être en avant des étapes à franchir. Donc, la logistique d'avoir ces centres-là, être préparé, etc., se fait. Mais en termes réalistes, la question de discussion aujourd'hui, c'est qu'il n'y a pas assez de volume de vaccins qui arrivent à Ottawa. Donc, on fait un triage actuel pour prioriser les groupes les plus vulnérables que nos experts nous indiquent, dont Dr. Etches et son équipe. Je ne crois pas que ces centres-là vont être en mesure d'ouvrir avant qu'on a un nombre suffisant de vaccins qui arrivent, parce qu'on ne passera pas à la vaccination dite massive de la population avant cette étape-là. On a à franchir pour finir nos gens les plus vulnérables, des gens visés du secteur de la santé. Par la suite, on va faire l'ensemble du secteur de la santé, des travailleurs du secteur de la santé, et on va passer par la suite au niveau provincial aux gens qui vont être identifiés comme essentiels. Donc, il y a plusieurs étapes avant qu'on rentre dans la population générale. Peut-être à une de ces étapes-là, une ou deux de ces centres seraient ouverts pour aider à vacciner ces gens-là, mais je vois ça encore parce qu'on n'entend pas du gouvernement provincial que de grands nombres de volumes de vaccins vont arriver sous peu. Donc, avant que ça arrive, ces centres-là ne seront pas nécessairement très avantageux d'être ouverts parce qu'on va avoir des centres ouverts avec des gens qui seraient prêts à vacciner sans avoir de vaccin. C'est vraiment ça qui va nous donner une direction d'une façon ou d'une autre.
OK. Mais juste pour revenir à la question originale, est-ce qu'il y a on a une idée du temps que ça pourrait prendre avant que... Non, pas à ce
Non,
point-ci.
on n'a pas encore eu, ou du gouvernement fédéral ou du gouvernement provincial, une claire indication du temps exact quand on va recevoir massivement un nombre de volumes. Puis on pense que ça va être plus vers le printemps.
OK. Et ma question de suivi pour vous, M. Dimonté, bon, on a mentionné que les rassemblements intérieurs sont une source primaire de transmission de la COVID-19 depuis quelques jours. Durant le temps des fêtes, est-ce qu'il y a eu beaucoup d'interventions qui ont été nécessaires pour des rassemblements illégaux?
Il y a eu des interventions, oui. On a eu certaines plaintes et on est intervenu dans certains domiciles privés où il y avait des rassemblements au-delà des gens de cette maison-là, si vous voulez. Mais pas significatif. J'ai pas les chiffres avec moi exactement. Par contre, on continue à suivre cette évolution-là. Le docteur Etches et l'information qu'il possède dirige souvent nos interventions au niveau de l'équipe de règlements municipaux. Donc, on continue à suivre ça de près. On continue à encourager les gens de respecter ce qu'on leur demande de faire.
Merci.
Merci beaucoup, Julien. We will now go to Stu Sharing on the city from the burbs. Sue, are you there? Okay, so we will go to Elizabeth Payne of the Ottawa Citizen.
Thank you. It's a question for Dr. Etches, I believe. Yesterday, Dr. David Williams was talking about vaccinating in long-term care and said the hotspots in the province with Moderna should have all long-term care residents vaccinated sometime later this month. How much vaccine do we have for long-term care and retirement residents? How long, therefore, will it take to get them all vaccinated?
Thanks. Our goal is as soon as possible. So by the end of the month sounds like too long from now. We would certainly be aiming for as fast as possible in the next week or two. The weekly allocation of vaccine that will be required is reviewed week by week. So it's hard for me to say definitively, that I can't really confirm the quantities that will be available. That's assessed and confirmed week by week. I don't know, Tony, if you wanted to say anything more.
Yeah, Elizabeth, I think Dr. Etches has given you a clear indication. We are not at the mercy, because that sounds like we're waiting, but the province is allocating to each region the vaccine. And so what we've done is we're pivoting because now we can't move the vaccine into the long-term care setting. So we're going to focus on that with the Ottawa Hospital partners. At the beginning, we couldn't. We were asking workers from long-term care to come to the Ottawa Hospital, and because they were mobile, they could do that. But now that we're able to take that, so we're going to relook at the allocation, and we're going to focus it on trying to get our long-term care and residents done as quickly as possible. So again, we are very much at the mercy of the amount that's allocated to Ottawa. But I can tell you, as Dr. Edges has indicated, that is our top priority, and every drop that we can, we'll be putting into arms into those vulnerable residents.
Okay, if I could just get maybe from either of you some more specifics on that. Could you help me with how many doses it will take to vaccinate everybody? How many you now have on hand? And like, when does it become a question? If you're saying it might be done in a couple of weeks, is that realistic at this point, or does it depend what comes next week?
Yeah, I would. I'd like to give you a definitive answer, Elizabeth. It really depends on what we get, and that's not driven by us. What is under our responsibility is to be ready, and that is what you've seen. And we're more than ready. We're ready for mass vaccination. We're ready for all the other steps. The teams have done that, and then Dr. Etches and I in memo, we've outlined the plans for that. So it really is just a question of the amount of vaccine, and that varies, as Dr. Etch has indicated. We get that on a weekly basis. We find out week by week. There's a complex process with the federal government and with the provincial government. So we're not at the mercy. I keep using that word, but we are victims of what we get. Then once we have it, we can ensure that it's done and it's triaged appropriately, and it's given to the populations that require it first. So I know not a good answer. It's not giving you what you need, but that's where we're at currently.
Sorry to draw it. Could I just clarify how much there is right now for long-term care? Like what numbers you can do in the next couple of days?
It's Vera. I think these questions sometimes are better also for the Ottawa hospital that actually receives the vaccine and has it on site. I do have, I don't know if Marie Claude, who's leading a lot of our vaccine-related work, has any more details, but I feel like I'm going to give the wrong number because I'm not quite overseeing that work. But in terms of doses received to date, and then amount given, and then what's going to have to be given today, the rest of this week for second doses, you can see that we have to piece it together. Marie Claude, is there anything you can add? You're working with the hospitals.
We are, so as you said, Dr. Etches, we are working very closely with the Ottawa Hospital and discussing on a week by week, as Anthony DeMonte said, and making sure that we agree on the number of doses and are able to move to the long-term care. So we are moving forward with the Pearly Rideau Vets today, tomorrow, and rolling it out to more long-term care as we get the doses allocated to Ottawa Public Health.
Okay.
Thank you very much, Liz.
Thank you.
We will now go to Taylor Blewett at the Ottawa Sun.
Thanks. Both of my questions are for Dr. Etches, actually. First of all, is it your sense that the provincial shutdown is actually making a substantive difference is going to do so when it comes to disrupting COVID-19 transmission in Ottawa as the shutdown currently exists? Or do you think more needs to be layered on, or should aspects of the shutdown change as we move forward, in your opinion?
I think that the lockdown measures right now should be making a difference. It's just been a week, and so it's early for us to be able to see that. The rise that we're detecting, the outbreaks that we're detecting, would all have been infections that started before the lockdown or close to. The thing I have my eye on is how has the lockdown fared in other jurisdictions with similar approaches. And we do look at what happened in Toronto and Peel, who went into lockdown earlier. There's no question it made a difference in stopping that rapid rise, and that it's been hard to turn the curve. And so it does make sense to look at other jurisdictions that are taking stronger measures, because the faster we can turn the curve, the less enters into hospitals, the less outbreaks that are caused, the faster we can get back to the schools and the services that we need.
And for you, when you talk about those stronger measures, what would be the first you would like to see implemented if we get to that point? I know you said, we're seeing where things go, but I guess what would be for you the first you'd like to see layered on?
I think this is a good conversation for me to have with the province and others who are reviewing the science behind different public health measures, the public health measures table. I think that what we're trying to achieve is less mobility, less moving people around to, which leads to contacts with others. So fewer contacts with other people is really the goal. And so taking a look at what is driving some of the movement and the contact between people right now in our communities, and how do we decrease that? When we do our case and contact management, we see the number of contacts has gone up. And so, taking a look at what is essential would be important. thinking about our schools. All of these are elements that, if we look around the world, we know people are using these approaches.
Thanks.
Thank you very much, Taylor. Nous allons maintenant passer à Thomas Laberge à Radio-Canada.
Oui, merci. Bonjour à tous. Mes questions vont être pour Dr. Etches. J'aurais besoin d'une réponse en français et en anglais, s'il vous plaît. Donc, je voulais vous demander, parce que là, on voit que le gouvernement du Québec étudie la possibilité d'un confinement très strict pour plusieurs semaines et peut-être même la possibilité d'un couvre-feu. Est-ce que vous avez des craintes que ça pourrait avoir un impact sur la ville d'Ottawa, surtout quand le confinement de 4 semaines qui a été annoncé va s'estomper, donc le 23 janvier? Est-ce que vous pensez que ça pourrait, par exemple, créer des mouvements vers des Québécois vers Ottawa et ça pourrait augmenter les cas?
On a toujours besoin de regarder l'impact des mesures après le fait, de déterminer exactement qu'est-ce qui se passe. Mais j'imagine que ça peut aider Ottawa. Si les gens de Québec restaient chez eux, s'ils voyagent moins, ils ont moins de contacts, ça peut aider Ottawa parce que nous deux populations sont connectées. Je pense, je retourne le fait que nous avons le même avis maintenant à Gatineau et à Ottawa, c'est de limiter nos contacts, de rester chez eux et si on fait le même les deux côtés, ça peut protéger toute la population. Parce que la mobilité continue entre les deux régions parce qu'il y a des travailleurs, il y a des familles où il y a quelqu'un qui a besoin de soutien d'un membre qui habite à l'autre côté de la rivière. Alors, c'est clair, nous sommes une région et si les mesures sont plus strictes à un côté, ça peut peut-être diminuer la quantité de COVID-19 là. Et ça peut aider peut-être, mais on a besoin d'étudier l'impact en réalité.
Et en anglais, s'il vous plaît?
Oh, okay. Sorry. So I believe the question was whether the more strict lockdown measures in Quebec that have been announced will have a negative impact on rates of COVID in Ottawa. And my sense is that it could actually help because we're one population that's connected. If there are measures that reduce the level of COVID on the Quebec side of our national capital region, that could help reduce COVID on our side because we are connected. We see people continue to travel for work, to care for a family member on both sides, back and forth. That mobility will likely continue for those essential purposes. And so I'd also return to the fact that we actually have the same advice right now to populations, public health in Gatineau, public health here in Ottawa. We're saying, stay home as much as you can, limit your contacts, and that should help on both sides.
En suivi, je voulais savoir, est-ce que vous pensez qu'il ne faudrait pas que justement Ottawa ajuste ses mesures finalement en fonction de Québec et même est-ce qu'on pourrait penser au retour des contrôles policiers sur les ponts entre les deux villes?
Votre question, c'est concernant les ponts et je n'ai pas d'informations concernant le plan pour les ponts.
Non, mais ma question plus largement, c'était de savoir est-ce que Ottawa devrait s'ajuster aux mesures de Québec? Est-ce que si, par exemple, Québec met des mesures plus sévères en place, il ne faudrait pas qu'Ottawa également mette des mesures plus sévères, justement pour éviter qu'il y ait des mouvements de population? Et la question des ponts était peut-être l'une des mesures parce que ça a déjà été ce qui a été envisagé donc, lors du la première vague.
OK. Pour moi, mon avis pour la population à Ottawa est basé sur les données ici à Ottawa. Le taux de COVID-19, les éclosions, les hospitalisations. Et aussi, je suis... je m'excuse. Je suivis la direction de la province de l'Ontario. Alors, si je pense qu'il y a quelque chose d'important d'ajouter dans les mesures en place à Ottawa, mon avenue, c'est de parler avec la province d'Ontario. Mais c'est basé, mon avis, c'est basé sur les chiffres ici, pas les politiques de Gatineau.
Merci
Et
beaucoup.
excusez, j'aurais besoin de la deuxième réponse en anglais également.
So I believe the question was whether I would make recommendations for stronger measures in Ottawa because of any risk associated with the measures in Quebec. And my recommendations for the people in Ottawa are based on what's happening in Ottawa, what's happening with the level of COVID in our community, the outbreaks, the hospitalizations. And I'm following the direction of the province of Ontario. And so if I think there's more needed in Ottawa, more protective measures, then my avenue is to speak to the province in Ontario. And that's the, that would be the next step.
Merci beaucoup.
Merci beaucoup. Nous allons maintenant passer à Étienne Malouin à TVA Gatineau, Ottawa. Étienne, êtes-vous parmi nous? Okay, we will move on to Jake Davies at West Carleton Online. Jake, are you there?
Yes, I am. I'm also trying to make lunch for my daughter. Okay. Thank you for taking the time to speak with us. I'm focused on the rural outreach and the rural vaccination program. As I'm sure you're aware, Goleta is 50 kilometers away from the closest clinic, which is expected to be in the Canada area. Fitzroy Harbor, 40 kilometers, etc. Is there a plan to reach these rural communities in Ottawa with your mobile clinics, or how do you plan on making sure there's vaccinations? As you know, West Carleton is full of seniors as well.
Yeah, so absolutely, that's a great question, and it is part of our planning. The team is already looking at that. So, and you've touched upon one of a couple of models that we're exploring and getting prepared. In our memo, we gave broad strokes so people would kind of understand, broadly what we're looking at. And yes, we have 4 sites currently looking at the big urban center. We're actually looking at other sites that will be set up in areas that are with more vulnerable or racialized and people that have been more impacted. So we're going to open other things. But directly to your question of rural, so yes, one of the strategies that is prepared and ready, the mobile teams that are being used right now for the long-term care. Once that's completed, because we won't be getting out to the general population, they'll be able to pivot and shift, and we'll be able to use them to do some of the rural communities, and we'll be working with them to do that as well. When we get to the mass vaccination, depending on the products that are available to us, we're looking at while we have currently provincial direction as to the size that these centers have to be, the square footage, etc., we feel that as we move further on, we'll be able to look at other options. So some community centers in the rural areas, etc. So those are all strategies the team is working on right now, and that are being prepared as well too. So we understand, we live it every day. This is a very unique and diverse city, with both an urban, suburban, and rural setting, and we need different strategies. So those strategies are being developed and will be ready when we have the vaccine to get out there. And in the interim, for those populations that are elderly or more frail, and some of the long-term, some of the residential centers there, the mobile team will be actioning those as we move in our plan.
Great, thank you. I know, I think it was roughly 2 months ago, the city of Ottawa hosted a flu vaccination at the Kinburn Sensplex, Councillor Eli L. Shantiri at the time was saying that this might be a model. I mean, it worked well. I was there. The issue, though, is it was outside, and it sounds like some of these vaccinations programs might be coming in the colder months. Maybe, sorry, go ahead.
Yeah, so to directly that question, I think you've identified it. Yeah, a model that worked well. You're right. There's an issue about timing. I don't, we'll see where we are. If in the warmer time of the year we can do that. But we also have other strategies. You may not be aware, but we have 3 paramedic buses that are actually like mobile clinics that could be deployed in some of those areas too. That's part of our strategies, and we're looking at other capabilities. We have in the city's disposal, and that's the great advantage of the way we've approached this as a team with public health, with our hospitals in the city. I can pull in. We have mobile hospital tents too for disasters that we could perhaps set up in certain areas, and they have heating and air conditioning capabilities. So we're looking at all those options are not only being explored, they're being prepared to be able to, again, I keep referring, but when we have enough vaccine to get there, we're going to ensure that we're not hindered by any of those logistical challenges. We have solutions for them.
Great. Thank you very much.
Thank you very much. That is all the questions that we have today. Thanks everyone for your time. Merci à tous pour votre temps aujourd'hui. Hope everyone has a lovely day. Bonne journée à tous.
Merci.
Thank you. Take care.
Thank you, Kina.
See you, Joanne.
Thanks, everyone.
Merci. Thanks, Kina.